Hi, my name is Mark Olives, and today I'd like to give you a little introduction to the shoulder. The shoulder is one of the most common injuries that we see in physical therapy, and a lot of people don't understand the mechanisms. And once you understand how the shoulder works, hopefully this can help you to keep from injuring it or help recover from an injury. So first of all, just to talk about some basic anatomy, I brought my shoulder, which is a little messed up because it's actually missing the collarbone, which actually should be fitting right in here. But this would be like a right shoulder. This would be the arm bone or the humerus. And then the muscles that actually function on the shoulder, or the rotator cuff muscles, sit with one big giant muscle on the front and then three on the back. So one is here, one is here, one is here. Now the function of the rotator cuff is to make sure that the arm or the shoulder stays centered in the socket right here. And you might not be able to tell, but the socket for the shoulder, it's very, very small. And it needs to be small because the shoulder is the most mobile joint we've got in our body. It has to go a lot of different directions. So unfortunately, the more mobile a joint, the less stable a joint. So it's a very inherently unstable joint, and that's why it does get hurt a lot. But what the rotator cuff does is it needs to keep this bone, or the head of the humerus, centered in the socket here. If it does not, what's going to happen is when the big muscle, the deltoid here, so the deltoid is a muscle that starts or initiates up here, and then it goes around and then attaches to the bone here. When it contracts, what it's going to do is pull straight up. Now if this bone gets pulled straight up, what's going to happen is it's going to smash right into the top of the acromion process, which is a little extension of the scapula here, or the shoulder blade. So the shoulder blade has a little ridge that comes up here and forms basically the roof of your shoulder. And if you reached over and touched that hump that's on your shoulder, that would be the acromion process. And so if this head gets pulled right up there and smashes, it's going to create a lot of trauma. And what it creates trauma on is the rotator cuff tendons. So the rotator cuff sits here. The tendons, which are simply connectors, they connect the muscle to the bone. These tendons here are going to move upward and get smashed right up against there. That's going to create a rotator cuff tendonitis. Once you get a tendonitis, now you've got pain in a tissue. The body's reaction to pain is usually guard and protect or stop using it. So now if these muscles stop working, that means they're going to continue to allow this smashing. I'm backing up a little bit. I never really did talk about the rotator cuff enough there, but what the rotator cuff's job is as that big deltoid muscle wants to pull up, the rotator cuff actually pulls down. So it helps keep the head of the humerus centered in the socket there so that you don't get compression on the top of that roof. So that's the big basics of what the rotator cuff does. And then additionally, just to make things more complicated, all the muscles that surround the shoulder blade here, their job is to help rotate the entire shoulder blade. As you lift your arm up, 2/3 of that movement, you're getting movement of the shoulder blade. So it's a finely orchestrated movement. And that's why there are so many shoulder problems, because there has to be so many things that happen in a very precise manner. And if they don't, you get impingement of the rotator cuff, that causes problems. Stay tuned for another video I plan to make soon, and that's going to be my favorite exercise to help the rotator cuff recover once it has been injured. I hope this helps you out. Thanks.